Lower back pain is one of the most prevalent health complaints globally, impacting people of all ages and lifestyles. It can arise from various factors, including poor posture, muscle overuse, or more serious conditions like degenerative disc disease. The discomfort may manifest as a dull, persistent ache or a sudden, sharp pain that restricts movement. Stiffness in the morning or after prolonged sitting is also a common symptom, often making daily activities challenging. Recognizing these signs early is crucial, as they can indicate underlying issues that need attention. The pain may worsen with certain movements, such as bending, lifting, or twisting, and can sometimes radiate to the hips or legs. Muscle spasms may accompany the discomfort, further limiting mobility. In some cases, the pain is temporary and resolves with rest, while in others, it becomes chronic, persisting for weeks or months. Identifying triggers. Whether it's prolonged sitting at a desk, improper lifting techniques, or lack of exercise, helps in addressing the root cause. Beyond physical strain, stress and mental health can also contribute to lower back pain by increasing muscle tension. Understanding these connections allows for a more comprehensive approach to management. Simple adjustments, such as improving posture, incorporating movement breaks, or practicing relaxation techniques, can make a significant difference. Early intervention with proper guidance, whether from a healthcare provider or a physiotherapist, is essential to prevent the condition from worsening and to restore quality of life. The lumbar spine, also known as the lower back, is a crucial part of the human skeletal system. It is made up of 5 vertebrae labeled L1 to L5, which are larger and stronger than the vertebrae in the thoracic and cervical regions. These bones bear the weight of the upper body and provide stability, while allowing for a wide range of movements, such as bending, twisting, and lifting. The lumbar spine's design is essential for maintaining balance and absorbing the shocks experienced during daily activities like walking or running. Between each vertebra are intervertebral discs, which act as cushions to prevent bone-on-bone contact. These discs have a tough outer layer called the annulus fibrosus and a soft, gel-like center known as the nucleus pulposus. When these discs are damaged, such as in a herniation or degeneration, they can press on nearby nerves, causing pain. Surrounding the vertebrae are muscles, tendons, and ligaments that provide additional support and flexibility. The muscles in the lower back, including the erector spinae and multifidus, help maintain posture and facilitate movement. Ligaments, such as the anterior and posterior longitudinal ligaments, keep the vertebrae aligned while allowing controlled motion. Damage to any of these structures can result in discomfort or chronic pain. For example, strained muscles or ligaments from overuse or improper lifting can lead to acute pain. Similarly, conditions like osteoarthritis may cause the cartilage between the joints to wear down, leading to stiffness and reduced mobility. Understanding the anatomy of the lumbar spine helps in identifying the source of pain and guides effective treatment strategies, such as targeted exercises or ergonomic adjustments to reduce strain on these vital structures. Proper care and awareness of spinal health can prevent long-term complications and improve overall quality of life. Lower back pain is frequently attributed to several common causes, each affecting the lumbar spine in distinct ways. One of the most prevalent issues is herniated discs, where the soft cushioning between vertebrae ruptures or bulges, pressing on nearby nerves. This often results in sharp, radiating pain, especially if the sciatic nerve is involved, a condition known as sciatica. Sciatica itself can cause discomfort that travels from the lower back down the leg, sometimes accompanied by tingling or weakness. Another major contributor is arthritis, particularly osteoarthritis, which leads to the gradual breakdown of cartilage in the joints, causing stiffness and chronic pain. Poor ergonomics, such as slouching at a desk or using improperly adjusted chairs, can also strain the lumbar region over time, exacerbating discomfort or triggering new issues. Recognizing the risk factors associated with these conditions is crucial for prevention and early intervention. Sedentary lifestyles, for instance, weaken the muscles that support the spine, making them more susceptible to injury. Conversely, sudden or repetitive heavy lifting, especially with improper form, can overburden the lumbar spine, leading to muscle strains or disc problems. Even everyday activities like bending or twisting incorrectly can contribute to long-term damage if done repeatedly. Identifying these habits early and making adjustments, such as incorporating regular movement breaks or learning proper lifting techniques, can significantly reduce the likelihood of developing chronic lumbar pain. Understanding these causes empowers individuals to take proactive steps towards spinal health and seek appropriate care when needed. Lower back pain manifests in various ways, and recognizing the symptoms early can make a significant difference in treatment outcomes. For many individuals, the discomfort begins as a dull, persistent ache in the lower back, often exacerbated by movement or prolonged sitting. This type of pain may come and go, making it easy to dismiss initially. However, ignoring these early signs can lead to more severe issues. In some cases, the pain becomes sharp and localized, particularly after lifting heavy objects or twisting awkwardly. This sharp pain often indicates muscle strain or ligament sprain, which, while painful, can often be managed with rest and proper care. More concerning symptoms include pain that radiates down the legs, commonly known as sciatica. This occurs when nerve roots in the lumbar spine are compressed or irritated, causing pain to travel along the sciatic nerve. Alongside radiating pain, individuals may experience numbness or tingling in the legs or feet, signaling nerve involvement. Weakness in the legs or difficulty lifting the front part of the foot, foot drop, are red flags that require immediate medical attention. These symptoms suggest significant nerve compression, which, if left untreated, could lead to long-term damage. In some cases, lower back pain is accompanied by other warning signs, such as loss of bladder or bowel control. This rare but serious symptom indicates cauda equina syndrome, a medical emergency that demands immediate intervention. Even without such extreme symptoms, persistent pain that disrupts daily activities or worsens over time should prompt a visit to a healthcare professional. Early evaluation can help identify the underlying cause, whether it's a herniated disc, spinal stenosis, or another condition, and guide appropriate treatment. Paying attention to these warning signs ensures timely care and prevents further complications. When it comes to managing lower back pain, evidence-based treatments are essential for effective relief and recovery. Physical therapy is often the first line of defense, focusing on strengthening the muscles supporting the lumbar spine and improving flexibility. A physiotherapist can design a personalized exercise program tailored to the individual's specific condition, which may include stretches, low-impact aerobic activities, and core strengthening exercises. These targeted movements help reduce pain, improve mobility, and prevent future injuries by correcting imbalances and promoting proper alignment. Medications also play a role in pain management, particularly for acute symptoms. Over-the-counter pain relievers like ibuprofen or acetaminophen can alleviate inflammation and discomfort, while muscle relaxants may be prescribed for severe muscle spasms. In cases where nerve compression is involved, doctors might recommend corticosteroid injections to reduce swelling and pain around the affected nerves. However, medications are typically used as a short-term solution, and their long-term use should be monitored to avoid potential side effects. For severe or persistent cases where conservative treatments fail, surgical intervention may be necessary. Procedures like discectomy, laminectomy, or spinal fusion are considered when structural issues, such as herniated discs or spinal stenosis, are causing significant pain or nerve damage. Surgery is usually a last resort, and the decision is made after thorough evaluation by a spine specialist. Post-surgery rehabilitation, including physical therapy, is crucial for restoring function and ensuring long-term success. Beyond these treatments, pain management strategies such as heat or cold therapy, acupuncture, and chiropractic care may provide additional relief. The key to effective treatment lies in a multidisciplinary approach, combining professional guidance, patient education, and consistent adherence to prescribed therapies. Working closely with healthcare providers ensures a comprehensive plan that addresses both the symptoms and underlying causes of lower back pain. Maintaining proper posture is one of the most effective ways to prevent lower back pain. Poor alignment, whether sitting, standing, or lifting, places unnecessary strain on the lumbar spine. When sitting, Keep your feet flat on the ground, shoulders relaxed, and a slight arch in your lower back. Standing posture should distribute weight evenly between both feet, avoiding slouching or locking the knees. Investing in ergonomic furniture, such as chairs with lumbar support or adjustable desks, can also help maintain alignment during long work hours. Regular exercise is another cornerstone of prevention, particularly activities that strengthen the core muscles, such as pilates yoga or targeted abdominal exercises. A strong core stabilizes the spine and reduces the burden on the lower back. Stretching is equally important, especially for the hamstrings and hip flexors, which can become tight and contribute to discomfort. Dynamic stretches before physical activity and gentle yoga poses like the cat-cow stretch can improve flexibility and reduce tension. Ergonomic adjustments extend beyond furniture. For instance, lifting heavy objects should always involve bending at the knees and keeping the load close to the body. Avoid twisting while lifting, as this can strain the lumbar discs. Taking frequent breaks to move around if you sit for long periods is also crucial. Standing up and walking for a few minutes every hour can prevent stiffness. Small changes like placing frequently used items within easy reach or using a footrest further minimize strain. By incorporating these habits, individuals can significantly lower their risk of developing chronic lower back pain. To achieve long-term relief from lower back pain, experts advocate for a holistic approach that integrates physical, mental, and preventive measures. Consistency is key. Whether it's sticking to a tailored exercise routine, practicing mindfulness techniques, or scheduling regular check-ups with healthcare providers. A combination of core strengthening exercises, such as yoga or pilates, can improve spinal stability and reduce strain. Additionally, low-impact aerobic activities like swimming or walking promote blood flow and flexibility, aiding in pain management. Stress management plays a crucial role, as tension often exacerbates muscle tightness and discomfort. Mindfulness practices like deep breathing, meditation, or progressive muscle relaxation can help alleviate stress and improve overall well-being. Experts also emphasize the importance of ergonomic adjustments in daily life, such as using supportive chairs, lifting objects correctly, and taking breaks to stretch during prolonged sitting or standing. For persistent or worsening pain, seeking professional advice is essential. Physiotherapists can design personalized rehabilitation plans, while doctors may recommend medications or interventions if necessary. Regular follow-ups ensure that treatments remain effective and adjustments are made as needed. By adopting these strategies, individuals can not only manage their symptoms but also prevent future episodes of lower back pain, leading to a healthier, more active lifestyle.